What is MALT lymphoma in stomach cancer? MALT lymphoma in stomach cancer refers to a specific type of cancer known as gastric MALT lymphoma. This is a slow-growing form of non-Hodgkin lymphoma that originates in the stomach's mucosa-associated lymphoid tissue. This lymphoma arises from abnormal B lymphocytes, which are a type of white blood cell that plays a role in the immune system. It is classified as an extranodal marginal zone B-cell lymphoma because it develops outside of lymph nodes, specifically in the lymphoid tissue associated with the stomach lining. Gastric MALT lymphoma develops in the marginal zone, a specific area at the edge of lymphoid tissues. It is the most common type of marginal zone lymphoma. While it can occur in various organs, the stomach is the most frequent site for this type of lymphoma, accounting for about 1/3 of all cases. A significant factor in the development of gastric MALT lymphoma is a chronic infection with the bacterium Helicobacter pylori. This infection causes long-term inflammation of the stomach lining, which can lead to abnormal growth of lymphoid tissue and eventually lymphoma. The presence of Helicobacter pylori is strongly linked to the development of gastric MALT lymphoma. Eradicating this infection with antibiotics is often the first-line treatment, leading to remission in many cases. Gastric MALT lymphoma typically shows a dense infiltration of lymphoid cells that invade and destroy the gastric glands, forming characteristic lymphoepithelial lesions. It usually presents with nonspecific digestive symptoms, making diagnosis challenging without specialized tests such as endoscopy and biopsy. The prognosis for gastric MALT lymphoma is generally favorable, with high survival rates when treated appropriately. Treatment options include Helicobacter pylori eradication therapy, radiotherapy, chemotherapy, and surgery in select cases, especially if the lymphoma does not respond to antibiotics. In summary, MALT lymphoma in stomach cancer is a distinct, slow-growing lymphoma arising from immune tissue in the stomach lining. It is strongly associated with Helicobacter pylori infection and is primarily treated by targeting this infection alongside other cancer therapies if needed. If you have concerns about stomach cancer or MALT lymphoma, it is essential to consult with a healthcare professional for personalized medical advice.